Hi, my name is Haley Jaggers, and this is my presentation on patient perspective, living with sleep apnea. No matter what kind of illness or disease you have, there will always be struggles along the way. Whether it's with your provider, home care company, or insurance, the patient will struggle between using their life world voice and getting across their needs to the voice of medicine. First, I will introduce you to the patient. Then, I will explain what sleep apnea is and how it is a disease that affects millions. I'll move on to including specific discussions that took place during the patient interview. And finally, I will explain how all of that supports and summarizes my thesis. Let's get started. This is Damien. He's a 36-year-old male who is married and has 2 young daughters. Damien has 2 degrees from the University of Notre Dame, but he chooses to be a fireman because he loves it. He works 3 different firefighting jobs to support his small family. Damien was diagnosed with sleep apnea about 2 years ago. What is sleep apnea? That's a great question. Let's break it down a bit. Apnea is a Greek word that means without breath. So literally, it means sleep without a breath. More than 18 million adults in the United States have obstructive sleep apnea, and that number is increasing every year and does not include how it is affecting people worldwide. Although OSA can be easily diagnosed and successfully treated, most people are not aware that they have it. OSA, or obstructive sleep apnea, is a condition in which the flow of air pauses during breathing while you sleep because the airway has become blocked. As you can see in this picture, there is a blockage in the airway due to the tissue sagging and closing off at the back of the throat. There can be a blockage in several areas, which makes identifying the exact location of the blockage difficult. Did you know, before age 50, men are twice as likely to develop obstructive sleep apnea as women? After age 50, the risk for men and women become the same. People experiencing sleep insufficiency are also more likely to suffer from chronic diseases, such as hypertension, diabetes, depression, obesity, and reduced quality of life and productivity. Snoring is a major indicator of OSA, but this does not mean that all people who snore have sleep apnea. In the United States, OSA is estimated to affect 1 in 4 men and 1 in 9 women and affects 23 million working adults. It is estimated that less than 25% of OSA sufferers have been diagnosed. Now that we know a little bit more about what sleep apnea is and how it affects everyone, let's take a look at my patient interview and how it affected Damien specifically. One of the questions I asked during my interview was, how does your sleep apnea affect you physically? Damien responded by, I was always tired. I would fall asleep at work or driving. Being a fireman and being tired on the job was not a good combination and became scary. I've developed high blood pressure, psoriasis, fatigue, bleeding issues, and my wife was telling me that I stopped breathing while I was asleep. Like many patients, Damien is using his life world voice, expressing how the disease affects his day-to-day life and family. I also asked him, how has sleep apnea kept him from doing things physically that he loved? He said simply, I'm a runner. I love to run, and there was a time where I just didn't have the energy to go out and run at all. There was actually a time where the symptoms I was having made me think I had some form of cancer, because I had seen the symptoms in both of my parents who had cancer. But after I had a sleep study and was diagnosed with sleep apnea, I knew those symptoms were stemming from that. I asked Damien how treating his sleep apnea has affected him physically. He replied, what a difference. I have way more energy now than I ever did. I don't need to take naps, and it isn't affecting my work, which was important to me. Because of my work, I can't wear my CPAP machine all the time, and when I don't, I can feel the difference. I'm exhausted all day, and I can't wait to get back to sleep to wear my CPAP machine so I can feel rested. Now that I wear my CPAP machine, I'm running again. Only now, my oldest daughter, who is 9, has taken up running as a hobby with me. I never thought I would have the energy to run again, let alone with my 9-year-old daughter. When I don't wear my CPAP mask, I get headaches, I'm tired, and even become irritable with everyone around me. Damien mentioned his irritability, which brought me to ask him my next question. How has sleep apnea affected you socially with your marriage, family, and friends before you were treated? Damien responded by saying, before I knew I had sleep apnea, I became very introverted and to myself, which was weird for me because I'm such a people person and usually very outgoing. It actually started to affect my marriage. How has being treated for your sleep apnea improved your quality of life socially? Laughingly, Damien joked that now his wife can't take him anywhere because he has so much energy, he's a ball of fun. His wife is also very happy that he isn't irritable as much either. Now with my 2 girls, he says, and my wife, there's nothing that we don't want to go out and do together as a family. I want to be with them and doing fun things all the time. How did sleep apnea affect you emotionally before your treatment? Damien responded, before I was being treated for sleep apnea, it caused severe depression. I actually developed what was called stress-induced psoriasis, which caused large red patches to flare up all over my body. What were some of the most challenging aspects of the whole process from diagnosis to treatment? Damien responded, insurance. Insurance and home care were the worst. I actually just got done paying off my CPAP machine because my insurance wouldn't pay for it. They said it wasn't medically necessary, even though I had prescriptions and results from 3 different doctors stating it was medically necessary. But rather than give the machine back because of payment issues, I decided to go ahead and pay for it on my own because of the benefits. The benefits I was receiving from it were much greater. The lack of communication and personalization from insurance and home care was unimpressive, to say the least. What challenges, if any, did you encounter with your primary care physician to get to the bottom of your symptoms? Damien said, my doctor was on maternity leave when the doctor's office got the results from my sleep study, but no one else in the office, other doctors or nurse practitioners who were filling in for my doctor's place at the time, called me to set up an appointment to discuss my results. This was frustrating and disappointing. We ended up switching doctors because we felt the office as a whole dropped the ball. So I asked Damien, why did you change physicians? He responded, there were a couple of different instances that I had where the doctor really wasn't taking me seriously, and she wasn't communicating well with me and my family. The physician we switched to is more convenient for me because she is located where I work, as well as she's a pediatrician, so now the whole family can go to the same doctor. How do you like your new physician's communication style, Damien? He said, with our new doctor, it never feels like she's rushing us. She doesn't interrupt, and she's great with my girls. She makes time to meet with all of us at the same time. In summary, the themes presented in this PowerPoint were that first, the patient used his life world voice to describe how his illness was affecting him physically, socially, and emotionally before he was treated for sleep apnea. Second, the patient voiced his concerns about how the insurance and home care companies made treating his illness and paying for his equipment very difficult. Third, the patient emphasized how he was disappointed with his previous doctor's office for the lack of communication with him about his diagnosis when his PCP was on maternity leave. And lastly, he praised his new physician and talked about how he valued his physician's time and willingness to be flexible with his close-knit family's needs. All of these things tell us that patients will tell you how things are affecting them by using their life world voice. that the home care company's insurance are treating patients like a number or a statistic, and not like individuals with a disease and needs. Medical offices may not have proper protocol in place on who is to call and discuss results with patients when a provider is out of the office for an extended period of time. And patients value physicians that take time and make an effort to accommodate their lives. All of these things show us that the connections between our text and patient care is very important. Good sleep is very important, everyone, so let me know if you have any questions about your sleep. I am a certified clinical sleep educator, but I am not a doctor, so if you are very concerned about your sleep, please talk to your primary care physician. Thank you, and I hope you learned a lot.